Stacie, you're wearing a beautiful outfit today. Did you see what I did there? So, for the listeners who are actually watching this YouTube video, you can see before I even preface this.
Or you might have been able to see in previous videos, because I have definitely gained weight, but was wearing bulky, I guess, clothing. But
so with that said, what's going on, Stacie? What's new? What's the latest?
I'm pregnant.
I'm like known for a while, and I'm like,
which is so funny because, like, when we first started the podcast, a big topic was like, do we want to have kids or not?
Funny how that works.
Well, it's so funny because my brother didn't know that we had recorded it a long time before we actually posted it, and he was like, so that was all bullshit that you were talking about.
Y'all were lying. What were you talking about? That's hilarious.
Yeah, but it's funny because back in August, well, it's funny because we were talking about you freezing your eggs.
And that was just February.
In February.
Last year. Yeah.
And Tyson and I remember asking you, if you knew where the doctor went, because she went to a different facility, because we were thinking of freezing our eggs. But then I was like, it's a lot of money, and we've never tried, we don't even know if we can get pregnant naturally. And so we had that conversation where we've talked about before, where do we think that we'll regret having kids more or regret not having kids more?
And timeline-wise, just to preface this before you continue, that was, again, months before you actually even had that actual discussion with Tyson, because when, for you listeners, it's like, wait,
it was at least 6 or 7, 8 months probably.
Yeah,
I think.
because there's that lapse.
It was in December, I think, that we filmed, and then it was the following August where Tyson and I had that conversation, and we both agreed, we felt that we would regret not having kids more than having them. Hopefully that stays the same once the baby's here. But yeah, so we were like, okay, let's just try for a year, and if we can't conceive or whatever, then we can look into other options. So we did the whole this, my period starts now, according to this tracker, these are the 5 most fertile days. So essentially we just made sure to have sex each of those days. Just
you did it medically. You did your work. You're like, this is how we actually do it.
And then so that very first time, my period didn't show up for a few days, and my period's been pretty consistent even since I've been off birth control for probably 5 years, just because I didn't like how it made me feel. But my period has always been really consistent, which was super helpful.
Yeah.
So once I was 2 days late, I was like, oh, okay. And Tyson, I was at 5 days bug, we'll take a pregnancy test.
Were you already kind of day 1, day 2? Day 3,
I think Tyson was more so because I was at first well, who knows? It could just be really late, but I've never been more than 3 days late.
That's huge. Yeah.
So around the 5-day mark, I took a test, and it had a faint pink, the faint double line, and I was I don't know, it's not really dark.
It's funny because we all take COVID tests, and we know once there's even a little hint, and that's so funny that you're well, I don't know.
And I've never taken a pregnancy test before either.
Really?
So it was the very first time, and so I was like, okay, well, let's just wait a few more days and I'll take another one. And I did. And it got a little darker. And then I took another one.
Did you still not believe it when it was darker?
I believed it, but I just wanted more confirmation, I guess. So then I took another pregnancy test that was it tells you pregnant, not pregnant. And so this one was pregnant. And Tyson's okay,
do you finally believe, Stacie?
Yeah,
do you finally
exactly.
believe?
So we found out pretty early And then we called Kaiser, our insurance, and they set up like our first appointment, which was at about like 8 weeks, I think is the first appointment. And it kind of takes off from there.
So just to reiterate to everybody, it was on that first try where you actually planned it and was just like, okay, let's try it here, track the days and see where I am in my cycle. That very first time you actually attempted, you got pregnant.
And I know like how lucky that is, because I know like so many people have so many issues with fertility. So I say that very lightly and not like celebratory, because I know that it's really difficult for people to even get pregnant. It's kind of like a miracle that it happens. And I've never been pregnant before. Tyson, that he is aware of, has never gotten anyone pregnant before. So we were both like, we don't even know if we're fertile together.
Wow. So you didn't even have, because that's what usually people do, I would assume, of like, people would try first because assuming that you have no problems, let's just try the natural way. And then if for some reason we've been trying for a while and nothing happens, then we'll take the tests. So it went smoothly for you too. Of like, oh, okay. Great.
So the getting pregnant has been smooth. The being pregnant
what's going on with that, Stacie?
So I think it was around like 6 or 7 weeks, like I started getting like really bad morning sickness. And they say morning, but all pregnant women know that it's pretty much all day and night if it's bad. And it was so bad. Like it was so hard to like even get up in the morning. Like I think the worst part for me, which like I've talked about this, I love skincare so much, and I hated having to wash my face either in the morning or at night was worse, because that was like when my nausea was like at its worst, was at night. And then like brushing my teeth was like, I dreaded that because I would always gag. Thankfully, like I think I've only like vomited like 5 times, but that was because it got to the point where it was like unbearable. Like there was no relief at all. And then the only relief came from like vomiting, and it was always like late at night. But it was, and then just like being tired all the time and being not, and I love to eat. Like, that's like one of my, like, I look forward, like, Tyson and I was like, what are we going to eat this weekend? What do you want to eat this week? And so to not, like, want anything was really hard for me, because I had no cravings. Like, even to this day, like, I think the only thing I've really craved is something I can't have, which is a cold deli turkey sandwich. Like that.
How much are you craving that right now?
So much. That's the only thing I crave, but I can't eat it because you're not supposed to eat like deli meat, or because it can cause listeria. But it's so funny because I was reading about all these things that pregnant women aren't supposed to eat because it can have like a bacterial infection from like listeria or something. But I'm like, well, should I be eating this? Because even though it's bad for my baby, could it be bad for me
as the individual?
Yeah. So that sickness. And I remember going to the doctor and they're like, it usually subsides like around week 16, I believe. It hadn't subsided for me at all by week 16. The doctor was like, okay, well, that's not normal, but like hopefully it starts getting better. By week probably like 20, 21, the daytime sickness was not as bad, but the nighttime sickness was still really bad. And then like, I think like the last week or two, it's gotten kind of better. But still, it's, yeah.
Oh my God.
Yeah, at night is probably like the worst, which is weird. Like, because they're like, make sure you eat something, make sure you eat small meals to like keep the nausea off, which kind of helps. So I wouldn't get hungry, I would get nauseous. And that's when I knew that I needed to eat something. And then, but at nighttime, like I'd always eaten dinner. So my stomach was full. So I had no idea like why I was having nausea still. But it's gotten better. I'm like able to, get up, I guess. Because I was like, thank God though, like I work from home, like remotely. Because I kept telling Tyson, like, I have no idea how women, like, go into a job or are on their feet all day. Or I know, like, even, like, seeing our labor and delivery nurses, like, some of them are pregnant. And I'm just like,
around,
I know.
with their bellies and just
incredible. Like, I
down.
don't know, because I was, like, working from my bed until, like, 1 or 2. And then I'd finally get up and like brush my teeth and wash my face. But it was just like such a chore to do anything. And I'm still like always out of breath. Like if I just like take a shower and get ready, I have to like like rest because it's such a chore to do anything. Yeah.
Oh my gosh.
Yeah.
Did it feel gradual with all these changes of like noticing, oh gosh, even just the simple daily activities of putting my clothes on? Was it just one day of like, oh, clocking, this is different?
I think it was gradual, although I feel like I've gained weight like so quickly because I've like see other people on social media who are like, oh my God, I'm like 20 weeks and I haven't gained any weight. And I'm like, oh my God, I've gained so much weight.
I'm like, I would want to gain weight if I am carrying a child. That's so weird.
I mean, it's good. Well, they weren't saying it like bragging. Like they were like, I'm concerned. Like, should I feel like I should be gaining weight? So it's like every pregnancy is so different.
Right.
Every woman experiences so many different things, and you're always, I feel like, questioning like, is everything okay? Like, I remember just seeing, like, Tyson tells me I should stay off social media because everything, like, bad that could happen, like, those videos pop up. Like, I went in for my 8-week ultrasound and it turned out, like, the baby didn't have a heartbeat. Or the baby I carried to term and the baby was born stillborn. Or I just saw one where the woman was like, they put me in a medically induced coma for 7 days and now I'm blind because I had an amniotic burst or something.
Did you really see all those TikToks in like consecutive videos?
No, this is like gradually because I feel like now TikTok is like all she wants to see is bad pregnancy.
That's what I'm saying. Of like, oh, it's clocking the time that you're even on those, and it's saying it even more and accumulating. I'm like, oh no.
And Tyson's like, why do you watch it? And I'm like, once it pulls me in, like I can't like turn away. He's like, well, you can't like look at just all like the negative stuff that can happen.
Are you like strategically putting positive pregnancy stuff so that will pop into your feed?
It's just my For You page, so it's not even like I'm searching, but I feel like if they've seen me watch a video all the way through, then they're like, oh, let's put this other one where this woman lost her baby or whatever. And I'm just like, oh my God. And I feel like I am such an anxious person already. Like the anxiety that this pregnancy has brought is like, I remember like, and I know I'm not alone because that's one thing about social media as well, is like you see all these other women who are going through the same things, which is a good thing. But every time like I would wipe, I'm like, is there blood? Like,
oh my God.
Yeah. So, because that's a bad sign. I mean, they say that spotting is like normal, but if you're having like a period, but still like anything, I'd be like, ugh. So yeah, just anxiety. Or if I have like cramping or pain or whatever, like you have to like go to the doctor, but I have like really sharp pains, which apparently is normal. So it's like you don't know what's normal and like what's not. So it's such like a mind.
What do you do? Like, I feel like I would want to call the doctor anytime I feel something.
You can.
Do you?
I called them more in the earlier stages because I was like, oh, like my discharge, like some of it was kind of like reddish brown or whatever, and they're like, that's normal as long as it's not like you're soaking a pad for like an hour. Then you would like call us or come in. Or I called for some other things like that they were like, that's, you know, normal, but if things get like worse, because I've had horrible back pain since like week 7, and it was that was something that I called, and they're like, yeah, that can be pregnancy related. But then also it's a sign of like dull back pain. Lower back pain is also a sign of like contractions. So I'm like, what? How do you read?
How do I know what kind of pain is what?
Well, I feel like they're just like err on the safe side and come in, and then we'll check you. But yeah, so it's just been, I don't know, like, getting pregnant, thankfully, was very easy, but the pregnancy has been very hard on me. Yeah.
How has that been so far?
Well, obviously,
Stacie?
like, the morning sickness has been terrible, the fatigue. I feel like at 20 weeks it started getting better, which they said, like, around 16 weeks it should. So when I went in for my 16-week appointment and I still looked like and was like miserable, the doctor was like, I'm so sorry, like usually it clears up by now, hopefully like it'll get better. I still have like nausea at night, but during the day it's pretty much good, so that's thankfully a good thing. But when we went in for our 20-week anatomy scan, because everything has been so good so far in terms of like the baby's health, the baby's growing,
Thank goodness.
all of the testing has come back, like, so everything has been good with the baby so far. But we went to our 21 week anatomy scan, where it's like a radiology ultrasound where they check like the baby's spine, the baby's skull, like everything to make sure everything's forming correctly. And so she did all of her pictures or whatever, and it was like a really long appointment, like 45 minutes to an hour. And she was like, okay, your husband can come back. We like saw the baby, but she was like, I'm just gonna send these photos up, and if the doctor says that you can leave, but just give me a moment. So we're like, okay, whatever. And then she comes back in and she's like, okay, you guys can leave, but they want you to go up to labor and delivery to go see the doctor. And I'm just like, my heart kind of sank. And I was like, is everything okay? She's like, they'll tell you up in labor delivery. I can't really say anything. So I'm like, oh my God, like my head immediately goes to like worst case scenario.
That's Stacie.
That's me.
That's classic Stacie.
Yeah, exactly. And so Tyson and I walk over to labor and delivery. We tell the nurse at the desk like what we're there for. She's like, okay, come in the room with me. They put me in like a hospital gown and put me up in like a contraction monitoring belt. And I remember, like, I just asked her, I was like, is everything okay? She's like, the doctor will be in soon to talk to you.
The same. It's like you hear that pattern. It's like, how many times
but the
am I
nurses
hear
can't
that?
say anything to us, which, I mean, I get. It just doesn't make it easy for you. So, like, once she said that, and, like, she's like, you'll be okay or whatever. And I just started crying when I was like putting my gown on. And then a couple more nurses came in, and every time they came in, they were like, how are you doing? I'm like, I don't know. And I would just start crying again. And then the doctor finally came in. He's like, how are you? Same thing. Just started crying. I was like, I don't know. He's like, I know. I'm so sorry that they can't tell you anything. But essentially what they found is the baby's good, but I have an incompetent cervix, which means like
incompetent cervix. Some phrasing is so interesting.
Yeah, so it essentially means I have a shortened cervix. And so I think I was measuring at like 1.4, and they want you to be like, they said anything like above like 2 or 2.5 is like concerning.
Did you say centimeters? Is it 1 point?
Centimeters,
Okay.
yeah. And so he was like, we're going to put you on progesterone, and hopefully that like strengthens the cervix, keeps it stable. But if not, then you have to have what's known as a cerclage, which is a surgery where we go in and we sew the entire cervix shut so that it keeps the baby in. Because what I'm at risk for is preterm labor and just the baby coming at any time. So I'm just like, oh my God. But there was some relief because I know my sister had something similar to it.
Okay.
So I remember calling her and she was like, yeah, that's exactly what I had. But the progesterone worked for me and I carried to full term. So, and she was like 45, 46 when she had her baby. And that's like, I'm same as her, very high risk just due to my age because I'm older. Exactly, geriatric pregnancy.
Like we talked about before.
Yeah, so I even have to be on like baby aspirin to help prevent preeclampsia. Like that was a medication they put me on early on. But so I called my sister and she was like, that worked for me, so hopefully it works for you. So that was at our 20-week scan. They told us, I have an incompetent cervix. We'll put you on this progesterone. You have to put it in like vaginally every night. And hopefully that strengthens your cervix and you don't go into preterm labor.
How are you feeling? How were you feeling during that time once you received the news, but knowing, okay, my sister went through that? Having all that information, what was going on with you?
It was a lot, but knowing that she had it before, I was like, okay, it like works. Like the progesterone can work. Hopefully it will work for me. So our follow-up appointment a week later, they checked and they're like, hey, it looks stable. So I'm like, okay, good. Second week appointment, the doctor was like, okay, if I measure it here, it's like 2 something. But if I measure it here, it's 0.8. And anything below 1 centimeter, the high-risk doctor wants you to have a cerclage. So I'm going to send you up to labor and delivery now, and you're going to have the surgery. And I'm just like, what?
Come again now? What?
Yeah,
What?
but then she also wanted to check my cervix. And so I've never had it done before. And so she like had to go, she's like going in there with her hand and she's like, I'm sorry, I have to go all the way up there. And I'm just like, oh my God, like it's already painful. And I see Tyson out of the corner of my eye, like going like this or whatever. And I asked him later, I was like, Bub, what were you doing? And he was like, I was trying to get your attention to like get your mind off it. Because Tyson, as I've spoken before, I hate needles. And so he goes to me with not only to every single appointment, but every time I have to get my blood drawn, which is often. And he'll tell me like, Bug, look at me, like, don't look at the needle or whatever.
And do you?
Yeah.
Good.
And that
lovely.
Works.
Okay.
But this time...
What happened this time, Stacie?
Well, she's like going like all in there and it's like, she's like, I'm so sorry, I have to go all the way up. And so I asked Tyson, I was like, what were you doing? And he's like, I was trying to get your attention, you know, like I've done before. And I was like, I love you so much. But as much as I love you, gazing into your eyes while someone shoves their arm up my vagina is not gonna happen. So she shoved her arm up there. Finally, she was done. She's like, good news is the cervix is still closed. Because if it was open, that's bad. That means like, essentially like the labor could be starting. So it's like, okay, thank God. So then we go up to labor and delivery. They get me in a gown. I ate right before my appointment. So they were like, we can't do the surgery until 8 hours until you're like on an empty stomach. So I had to sit in the hospital for just like 8 hours waiting.
What did you do for 8 hours?
Nothing. I was just like trying to calm myself because I knew I would be getting so many needles.
Oh my God.
Because they have to give me spinal for the surgery to like numb the bottom half of my body. So there was just like so many needles involved. And we've talked about how much I hate needles. But
Stacie does not like needles, as we've heard in multiple
So they had to take my blood, but then they also had to give me an IV, which I've never had. I've never really had surgery except for like having like a wisdom tooth pulled out. So the IV was so gnarly for me. She tried to stick me here on my right, like, forearm. That didn't work. She said the vein, like, burst or something. So I'm not even
did that
looking.
Hurt like a
they all
mofo?
hurt.
Especially when they missed and were they like poking around?
No, she knew how like much I didn't like needles, but I don't know if that made her nervous.
I bet. Yeah.
Tyson always says she's not good with needles. And so then they put it in my hand, which was okay. But then another nurse came in. She's like, hi, I need to take your blood. And I was like, oh, no, I'm good. They already took my blood. And she was like, she looked at the order and she was like, no, I need to take your blood. blood. They ordered it again, and I'm just like, oh my God. Thankfully, like, she was so good. Like, she just like went from the
one
side.
stick and boom.
Yeah.
Oh, good.
And so they took that, and then I have the IV, and then my original nurse came, and she's like, sorry, the blood that I took was clotted. And I'm like,
Whose fault is that, nurse?
I don't even know how that happens, but they were so sweet, so I couldn't, like, get mad. But so she started the IV, and she put it, like, at, like, high, so it was just, like, going in there, and my arm just, like, froze. Like, it was so cold. And then finally, like, when it started, like, going at, like, a normal rate, like, it came back down. But I was like, I've never experienced that before. It was so weird because I couldn't drink or eat anything.
Oh,
so
my
they
gosh,
had to give me fluids.
Yeah.
So then the doctor finally came in, and he sat down, was answering all our questions, telling us, you know, about the procedure. And he was essentially saying that, like, because I was like, what is the success rate of, like, having a cerclage and carrying a baby to term? And he's like, well, you know, we never really know. But there's, like, 3 different stages where we put a cerclage in. The first stage is, like, you've had a preterm labor before or are at risk for it, and we knew that. And so we'll put it in, we'll do a cerclage, like, at 14 weeks, like a preventative one. That's best case scenario because we catch it so early. Worst case scenario is we find it on a physical exam and we have to do the cerclage. That's usually, like, the lowest success rate. So I was like, okay, so that's me. And he was like, no, we found it on your ultrasound. So you're kind of in the middle.
Okay.
So he's like, you have not as great of a chance as, like, the 14-week area, but then a better chance than, like, someone who finds it on a physical. So the physical exam would have been like if my doctor, when she shoved her arm up my vag, was like, your cervix is open. Wow. That's, yeah. So that's the physical one. And then he was telling us, like, okay, complication, because I asked him, like, what are complications? And he's like, worst case scenario is we go in there and we accidentally pierce the bag, which means you go into labor. Yeah. And so that's the only thing that I'm thinking, like, is going to happen. Of course. Like, that's the only fear I have.
That's all you hear once you hear it.
Yeah, exactly. So I'm just, like, the whole time, like, they bring me up finally, like, to surgery. And mind you, like, our dog Perla is at home. So, like, we're so worried about her. Tyson ran home to, like, take her out and feed her, and then rushed back to, like, be there for the surgery, even though he couldn't go in. So we go to the OR, they wheel me in. There's, like, 6 or 7 doctors and nurses in there. But I will say, like, everyone was so wonderful, like, so nice, answered all my questions, just very, like, encouraging and loving. Like, they were so nice.
So much support in that team, knowing that they're there for you.
Yeah, it was so nice. So that, like, put me at ease. But then I had to have the spinal, and, like, he had to, like, prick me, like, 6 or 7 times.
And is that normal?
I asked that. I was like, does it usually take this long? And the nurse was like, it can.
Are they? What's that?
Because he was, like, poking. Yeah. And I was like, well, something. I was like, I feel something. Because I think he was trying to numb me first before he put the actual spinal in. And the numbing was what he was having a hard time with, because he was like, okay, you feel it on what side, left side or right side? And then he would try and numb it again or whatever. Finally, he got it, because I was like, this is, like, the worst part. And then they laid me down, and it was the weirdest feeling. Like, I was completely numb from, like, the waist down. Which is good, but, like, I've never had that sensation before, and, like, feeling my legs and, like, not being able to, like, move them.
That's scary. It's like you're paralyzed.
You are paralyzed.
Of, like, oh, this is what it feels like.
Yeah, well, because I asked him, I was like, oh, is this, like, essentially like an epidural? And he's like, no, this is stronger than an epidural.
Than an epidural.
Because with an epidural, you have to be able to push. And And so I was like, oh, okay, great. And it was so crazy because, like, I remember when they were trying to lift me from one bed to the other, and I was like, oh, do you need me to, like, lift myself up or lift my, like, butt up? And they're like, honey, I don't even think you'd be able to if you tried. Yeah. So.
You're sweet.
Yeah, you're cute.
And, like, pretty.
Yeah, just sit there. But so the nurse was like, okay, they're starting, because there were 2 doctors in there who were doing it. And the anesthesiologist, everyone was so sweet. Like, he kept rubbing my arm and my, like, head and saying, like, you're doing so good. They're almost done. And I just remember, like, trying to listen to what they were saying, but they were, like, whispering.
So you're awake the entire time?
I was awake the entire time. Yeah.
Wow.
They said if the spinal didn't work, they'd have to do general, but general is much more dangerous for the baby.
Okay.
So thankfully the spinal worked. I was awake the whole time, and I remember there were, like, huge bright lights, like, and I remember I was like, I looked for a moment, I was like, I think that's a reflection of, like, my whole, like, inside, and I was like, okay, do not look at that.
Don't look. But weren't you a little bit curious?
No, I am not that person. Like, I don't look at any, I can't even look at getting my blood drawn. I definitely don't want to look at them sewing up my cervix.
That makes sense.
So I'm just trying to listen, like, for any little thing, like, that is, like, any little concern in their voice, but then I'd hear them laugh, and I was like, okay, if they're laughing, then, I mean, hopefully nothing's going wrong if they're laughing. And so the nurse was like, okay, they're almost done. And then finally the, like, procedure concluded. They said everything went well. Then they wheeled me back out to, like, in the recovery room where Tyson was. And I was just so thankful for, like, the whole team. Like, everyone was so, so amazing. Even the doctor, Tyson was like, I was so impressed with him because he didn't, like, rush us at all. Like, any questions we had, he'd just sit there and he'd wait. Like,
I appreciate
even if we were
that.
just, like, thinking, like, he didn't seem like... And he had a 24-hour shift.
Oh, wow.
That was the start. I think he was in the middle of his shift, because when I had to stay overnight, that was another thing that they told me, which was shocking to me. We just went in for, like, a normal appointment, hoping it would be fine. I slept for probably, like, an hour or 2, and then I woke up because my IV was so painful.
Oh gosh,
It was so painful.
Yes. You woke up from the pain.
Yeah, and they had, like, these compression things on me that would, like, compress my leg and then release. They were, like, hydraulic, I think, operated. But every time they'd release, it'd be like, and it was so loud. And I asked her, I called the nurse and I was like, is there any way you can take these off? Because I can't sleep at all. And she was like, yeah, let me check, because I think, like, they put them on me just in case blood clots or whatever.
Oh, yeah. Oh, wow.
Very scary. So she was able to take them off me, but the IV was still so painful, even, like, no matter, like, how. And then my back was in so much pain from, like, the spinal. So I'm just, like, bright-eyed awake at, like, 1:30 a.m. And I know, like, Tyson's not coming there till, like, 7 a.m. So I turn on, like, the TV. Thankfully, like, Game Show Network is on. Kyle, my Game Show Network buddy, our editor, Game Show Network was on. And so I watched that for a bit, and then I tried to sleep, and then I turned it back on, and Game Show Network at, like, 3 or 4 a.m., not cool. It's, like, infomercials.
Oh, no!
And I was like, oh, my God, what a nightmare. So I'm just, like, sitting there, and it was, like, the longest night ever.
Sitting in the pain.
I think at, like, 5, I called her, and I was like, because they weren't giving me fluids anymore, so I was like, is there any way, like, you can take this, like, IV out? She's like, let me go ask. And she came in, she's like, thankfully we can, because all of the medications we're giving you now are, like, oral. So she took it out. I swear to God, like, I thought she would be like, oh my God, like, it's embedded in your skin or something. No, it was fine.
Like, no, normal.
It was totally normal. It was just, like, a huge thing of blood, and I was like, ew. And she was like, okay, put pressure on it so that, like, the blood will stop or whatever. And it was so painful to just hold it. But then, like, after, like, 5 or 10, like, I think, like, after an hour, it, like, was fine. So thank God that they were able to take that thing out. And she was like, oh, see, this is why it hurts. There's this huge tube in you. And I was like, I did not need to see that.
Wow, I can't believe she said that. Oh, look at that. This is so cute.
Yeah.
Wow, look at that.
Yeah.
Yes, I know.
She was so sweet.
Yeah.
Everyone was so sweet, so I can't say anything bad about them because they were wonderful. And the surgery went well, which is good. And then the doctor came in to check me the next morning, and he was like, it looks like it's doing what we want it to do. And the stitch looks fine. So they discharged us, but that was...
Wow.
Yeah.
That
So
must have been the longest night.
It was the longest night. And it's just, pregnancy has been rough for me. Like, I mean, thankfully, like, I'm able to, like, do it, but...
You're such a trooper.
It's rough.
Oh, my gosh.
I mean, but there's, like, I think, and also, like, there's a sense of, like, guilt that I feel, because I feel, like, bad that, like, I feel like my body is, like, failing the baby.
Oh.
Because it's, like, not able to, like, keep him in there. So essentially from now on, we just go weekly to make sure, like, that the stitch is still working and that the baby stays in there. But if I have any bleeding or if I feel any contractions, then I have to immediately go into labor and delivery. So we went to our last checkup this week, and the doctor was like, it looks good. Essentially, from now on, every week is a win for us. We want to get you at least 10 more weeks, so the baby, but ideally, we take the stitch out at 36 weeks, and you carry to term. Mm-hmm. That's ideal situation. But every week, essentially, is like a win for us.
It's taking every win we can get, day by day, week by week.
Yeah.
And just, it's moments like that where even though it's so much pressure, it really forces you to, how can I stay in the moment and just be thankful for this present moment without looking too far ahead. It's such a challenge.
For me, that is such a challenge because, like I've told you, like, I had so much anxiety before this pregnancy, but this pregnancy has brought that on, like, even more. And I know I'm not alone because I know there's, like, a good and a bad side of social media to where, like, I see TikToks of, like, worst case scenario, women losing their babies, women having stillborn babies. And I'm just like, oh, my God, I think of all the worst things that can happen, or women going into comas, women not surviving and their babies not surviving. Or if the baby is not moving and because I've started to feel the baby, if it's not moving, is something wrong with it? Because... So I asked the doctor how often I should feel the baby, and he said sporadically right now, but I think at like 28 weeks or at a certain point they ask you to start counting kicks.
Oh. Yeah.
And if the kicks start getting lower, then I think you have to, like, go in, or if it's, like, drops significantly.
So where are you already starting to feel? Mm-hmm. You didn't tell me that.
Yeah. Well, at first, like, I was like, I don't know, is that gas? Like,
because I remember having that conversation, and we never established it.
Yeah.
So you officially have been.
Yeah. And Tyson's actually felt the baby. And so, so that's exciting. But then it also brings that anxiety of, like, okay, I haven't felt the baby in a bit. So, yeah. So the pregnancy's been really hard. But I think, like, Tyson has been, like, incredible, and I always knew he would be, like, wonderful.
But when you're actually going through it to experience and see,
I have not been able to do anything, and I love, like, keeping the house clean, like, doing all these things.
Your house is always immaculate.
It's not immaculate, but I haven't cleaned, like, a single thing since I felt sick. So that's been for, like, 5 months. He cooks every single meal for me. He goes to every single appointment, every single time I have to get my blood drawn. And he's just so, I mean, I'm so, like, grateful for him.
And he's always checking in on you. Of, like, did you take your meds?
Oh, he brings me all of my, when he brings me my food, he brings me, like, all my medications, my prenatals. He's like, Bug, you didn't take this one. When I had so many antibiotics and, like, anti-labor pills after the surgery. And so he was like writing them down, like, oh, she took this like this time, like you've taken the third one. Like, he's just so amazing.
Future baby daddies, please take note.
Yeah. Yeah. But he does like everything. And he's always like, but, or if I try to help, he's like, Bug, just relax or whatever. And I just feel bad because I know it's a lot. He works full time and he still has to like take everything on. He takes Pearl out every single time, feeds her. He's just been like amazing. I don't know like how I would do it without him. And
what a wonderful preview of what it's going to be like, of knowing that you have that type of support.
I know. I don't know how women who don't know, like, I actually thought that, like, when I was sick, I was like, if I didn't have someone, like, essentially, like, waiting on me hand and foot, like,
Unconditionally,
yeah, and not, like, making me feel bad about it or, like, complaining about it. Like, he doesn't complain
oh my
at all.
gosh, such a great attitude.
He'll get, like, frustrated sometimes, like, if I ask him to like do something. What was it? What did he get frustrated with? Something about? I can't remember. He'll get frustrated, but then like I feel like he'll feel bad about it. But if it was me, like I'd be like, I'm doing it. Like I feel like I wouldn't be as sweet as he is. But
he's showing a lot of grace in all of this.
Yeah. And he's just, and I always knew he would be like that, but it's not until it actually happens and you see it and he doesn't make me feel bad. He's tells me like, you need to rest, like you're like carrying, and he'll even be like, Bug, I can't believe like what your body's going through, like what you're doing. Yeah. And so, and then I have like, you know, support like you or like my sister or my parents, you know, calling to check on me or the text. Like I'm so grateful for everyone who's just calling. Like you after the surgery, you're like, how are you doing? Or even after every week, you're like, how are you doing? Or like I've had cousins, my sister, everyone checking up on me. Or I've had really sweet friends who like send me, who have had babies, who send me like, oh, this Instagram is like a great one to follow because it really helped me. Or another friend of mine like sent me books that were really helpful for her. And I'm just like so grateful.
We're all looking out, girl.
Exactly. Yeah. But yeah, so even though the process has been hard, it's incredible to have like so much support to make like the journey like so much easier.
And that leads me to this concluding thought that you said something earlier about that sense of guilt that your body is. I don't know how you described it, but the fact that your body has
it feels like I'm failing. My body's failing.
And that struck me because I hear it. You know, I hear it and I can see that perspective. But with what you just said of that wonderful support, like that's the converse of it. Yeah. While you don't have control of your body and that aspect of it, the blessing is that you see all of this wonderful support from the medical staff to friends to family that we're here with you. I'm getting so emotional, just like we're here with you.
Yeah.
And we're just all cheerleaders with you. And just
I know, and I feel
every step of the way that we're wanting this to be as successful and smooth for you just as much as you do.
I know, and I love everyone for it, so thank you.